Hello, ladies and gentlemen. Thank you very much for joining me today in this live webinar on dietary and herbal treatments for joint pain. First, I'd like to say that, there's no reason for 95% of people who have arthritic pain to be suffering. It's not part of aging. Of course, we can see a lot of people, even in their 20s and 30s, that now have joint pain. And just taking pain medicine isn't a cure. And we've seen the problems that have resulted with people taking, opiates and other pain reducing medication. By taking a pain reducing medication, including just aspirin, you're never removing the cause. You're just suppressing it. You're not putting out the fire. You're just turning the alarm off. And this is only going to allow the pathology of the disease that's destroying your joints to continue to progress, and you don't feel it. It's better you feel it. When you feel it, then you'll take action. I always say pain is your friend, because pain then wakens you up, makes you stop doing what you're doing and start looking for a solution. Now, of course, a lot of people just pick the easy, quick solution and take a pain med and keep going. But that's what I'm saying you need to avoid. You need to understand your pain. You need to diagnose your pain. You need to understand the causes of your pain and then remove those causes. And then you can look at herbal remedies, because herbal remedies have been treating pain and inflammation in the muscles, the joints, and the nerves for thousands of years. I get a lot of complicated cases every single day with people with multiple chronic health conditions. But treating arthritic pain is one of the easiest and one of the main reasons I have such a large amount of clients, because when they came to me, they had pain and their pain was resolved in 3 or 4 months and it hasn't come back. So when you treat the causes and you remove the causes and then you treat the arthritis naturally, it goes away. You don't have to take the herbs forever. It's not a medication that you take forever. 3 months, 6 months, sometimes longer. You have to take these herbs, but slowly they remove the causes. And then slowly your inflammation and joint pain subsides and you can live your life without this chronic pain or having to take pain meds. Let me just show you a few testimonials here. First of all, off of my website to a little bit motivate you. Here we can see on my website under testimonials, pain and inflammation related testimonials. And I like this line I put at the top: to treat pain, a holistic approach is always necessary. My program or approach includes anti-inflammatory diet, which we're going to cover, herbal products, some analgesic pain reducing herbal remedies, some detoxification of the joints or muscles, and often herbal oils, all used topically. Individually, each therapy helps improve the condition to some degree, but it's the right combination and proper application of each therapy that produces favorable results. This approach is very effective for joint and muscle pain, as well as nerve pain and intestinal pain, with different herbs and dietary guidelines per individual. So there's individual guidelines for everybody. Here we have some testimonials. Here a person has been taking the herbs for some time, maybe a few years, and she said she's tried many supplements. She's tried many different avenues to her health. Well, there's only one main approach to health care besides changing your diet, and that's herbal remedies. Herbal remedies have been used for thousands of years. We keep looking around for some modern quick method, but herbal remedies is really the only treatment that is completely natural and can be suited for any health condition. So anyway, she's tried many different things, and then she woke up one day with no pain. This person saved my life. I guess she had a lot of different issues there: depressed, overweight, pre-diabetic. Yeah, when we address somebody, we don't just address, their one condition. I'm always treating people holistically. You cannot just take a herb or herbs for your pain and ignore other issues like your life, like poor sleep, high stress, bad digestion, bad elimination. All these need to be resolved as well. Here's IBS testimonials are in here as well. It's a different subject. No arthritic pain here. No, haven't been this healthy for years. Better blood pressure, less urinating at night, all due to working with me. So we always address all these health conditions. No headaches, no more aches and pains. Another person here, they lost some weight, and they also had, she had so many aches and pains throughout her body. I was grumpy all the time. And then I, of course, give her these herbs and change her diet. And her sleep's better now, and her digestion is better now, and she has more energy. A lot of people are just taking coffee, trying to get through the day. This is like whipping an unhealthy horse. I always tell people, if you need 2-3 cups of coffee to get through the day, you have health problems. So this, a lot of times we get, this coffee can make your inflammation worse and increase your urination at night. So probably I got her off the coffee, no pain, no urination at night, address the health issues that were making her fatigue. And now she has lots of energy without the coffee. She even says, I feel 20 years younger. He understands different body types. We're going to see that Ayurveda is very sophisticated and breaks people down into different types of prakritis or body types, and even the condition themselves can be broken down into vata, pitta, or kapha, different types. So there's no one treatment. Another IBS case, stomach inflammation, headaches, nerve pain, abdominal pain. This person cut down on their pain meds. So she had some very severe lower back, buttock, and thigh pain, sciatica, and by taking the herb, she was able to reduce or stop her medication. Migraine. This person's commenting about some herbal oil helping the joint pain. Swelling. This person calls me a magician. The inflammation has been greatly reduced. I have less pain in my body. And this person had fibromyalgia, and now all of her fibromyalgia, which she had for years, was gone. And that was, of course, in 2011, 12 years ago. So I would say since that period, I have been successfully treating inflammatory conditions, including joint and muscle pain. So let's start here by talking about what are the causes of our inflammation and pain. And this, of course, is the best place to start, not in what herbs you need to take, but what are the cause? Because when we know the cause, then we can tell the type of pain you have. And then from the type of pain, we can choose the proper treatment approach and diet. Now, there are foods that are clearly inflammatory, but in Ayurveda, we're going to give each person still a unique diet. There's no one inflammatory diet. So don't be fooled by that. And just say taking foods that have high antioxidants or vitamin C, people think strawberries are going to be anti-inflammatory because they got vitamin C. So this is like a theory. We're not into theories. We're into, a pragmatic, practical approach that brings results. And, eating strawberries is not going to be sufficient to bring down your pain just because they have vitamin C. So it's very important to get away from that whole thinking of, oh, I'm taking a lot of antioxidants, I'm taking supplements. I sell no supplements. Herbs are not supplements. Supplements are something, a nutritional supplement like vitamin or mineral that's supplementing your diet. Maybe some nutritional deficiency you have. Maybe you're not getting enough sunlight. So you're having a deficiency in vitamin D. So you're taking a vitamin D supplement. Herbs are not supplements. They're herbal medicine. They're not alternative. They've been around for tens of thousands of years. Taking a little pill to solve your health problems, that's alternative. So herbal medicine is very old. And most of these formulas, or many of them that I talk about today, are old ancient Indian formulas. So back to the causes. One, the diet. This is the number one cause. And this is not the same diet you're going to read about on social media. for what are the inflammatory foods. This is surprising how inaccurate we see information on social media. For example, they advocate chocolate as anti-inflammatory because it has magnesium, but the cacao bean is inflammatory. So what are the most inflammatory foods? We'll just go quickly here. Coffee, inflammatory, but green tea, not inflammatory. So it's not the caffeine, it's the coffee bean that's inflammatory. And same with the cacao bean, it's inflammatory. Many people stop these because I do mostly Zoom appointments these days. And I tell people to stop these herbs, and then I'll mail them the herbs so they get the herbs in 3 or 4 days. And a lot of times they say, just stopping the coffee, the chocolate, and some of the other dietary changes you told me, already I feel my pain is 50% better before the herbs already arrived. See, you can't treat a condition like insomnia if a person's drinking 4 or 5 cups of coffee a day. I can't treat your inflammation if you're consuming inflammatory foods all day, like coffee, chocolate, sugar, all cookies, candy, white sugar. And fruit is not sugar. People think fruit is sugar. No, fruit has a type of sugar, but it's not an inflammatory sugar. It's just a fruit sugar. So, white sugar, cookies, candy. Oh, there goes the horse in the background. Lucky group. I'll be riding him soon. And also the most inflammatory food category is the nightshades. Now, more and more people are becoming aware of the inflammatory and even irritating effects of the nightshades. What are the nightshades? Tomatoes, eggplant, bell pepper, paprika, white potatoes. These are all nightshades. So people doing a lot of tomato sauce and salsa, are going to, and they already have inflammation. Now, I didn't say they were bad. If you're not having any pain, any inflammation in your body, fine, have your tomatoes. But if you're having inflammation or high blood pressure or irritable bowel, then you want to get off of these nightshades, or sometimes called acidic foods, tomatoes and eggplant in particular. Now, other causes overall, in a kind of a broader spectrum, causes of joint pain, of course, are inflammation. But all joint pain is not caused by inflammation. It can also be caused by degeneration. This is more of a vata type of condition where the bones are degenerate. We see people like this. They've been on fasting, juicing, living off of coffee, very thin, underweight, cracking bones for many years, and then they get a kind of osteoarthritis, or first maybe osteopenia, or a degenerative bone condition first, and then they get the osteoarthritis. So then the inflammation comes, but the cause was the degeneration, which was basically the lack of nutrition, insufficient eating, over dieting, and low fat. When you start to have cracking joints, crack, everything's cracking, skin is very thin. Well, fat is a lubrication as well. It's a protective substance that's protecting your joints, lubricating your joints, protecting every cell in your body. Every cell membrane has a fat coating over it, just like our body has a skin. And when this gets too depleted from an extreme low-fat diet, then you can start to see this type of degenerative arthritis. And of course, other type of major cause, which is not necessarily inflammatory, is just excess weight. So, excess weight on the body will put pressure on the cartilage, put pressure on the spine, and start pinching nerves, start putting pressure on the knees, and then it can become inflammatory. And those 3 categories, inflammation aligns with pitta type of inflammation, and degenerative bones aligns with, vata type of inflammation, and excess weight and stiffness, including swelling, aligns with kapha type. So those are the 3 main types of arthritis according to Ayurveda. The vata type, dry, cracking, and we have specific formulas for each type. We're going to go over these in a minute, but that's for this dry type. See, it's the pain and detox formula, nerve pain. See, for vata, we're going to talk about those, but that's for that type, that dry, cracking, usually a thin person, vata prakriti, vata vikriti, or somebody who's just been on a low-fat, very depleting diet for a long time. The second type is the pitta type of inflammation. Here we have burning heat. You can touch, you can feel the heat, you can feel the burning, you can feel the hot, the inflammation. So that's going to be, of course, very different. The vata type is usually cold and dry. So we have to have not cooling herbs. We can't have hot herbs. So we have special formula for that, for pitta type. You notice the word detox. We're going to talk about that. There's Kaishor guggulu. And then for a person who's very overweight, heavy, with a lot of swelling, and they have knee pain, joint pain, lower back pain from the weight. So we have, we use other types of guggulus, which we're going to talk about in a minute. This is the kapha one. And you can see it says right there for swelling, and stiffness and joint pain. There we got a Punarava guggulu and Kanchnar guggulu, two types of guggulu in there. We're going to cover those, but I wanted you to see those three main types. Now you can have combinations. You could have pitta and kapha, overweight person who's also got a lot of body heat. And in those cases, we often make custom formulas. Now there are other causes of inflammation and pain, which we're not going to cover. One, an autoimmune condition. You could have an autoimmune condition, which is like more of a rheumatoid arthritis, and there's different formulas for that. This is where the immune system is overactive and attacking your tissue, your connective tissue. And that would be fibromyalgia if it's connective tissue, rheumatoid arthritis if it was joint pain. So we have a different cause there. We have the immune system, and that immune system needs to be modulated with herbs. And this is a different approach. I have many webinars on autoimmune conditions. If you believe that your inflammation and your pain is due to your immune system, then you should watch those videos. Other causes of inflammation and pain are just infection. And by the way, when there's autoimmune, that's vata and pitta are imbalanced. And there's also infection can cause pain. Even when you have a cold and flu, your body can feel achy and stiff, and you can have joint pains. But chronic infections, even like herpes, Lyme's, can come with a lot of joint pain and inflammation. Those have to be treated separately, and that's usually a pitta and kapha imbalance, and that's a separate subject. And then nerve pain, we have nerve pain, which is specific formulas for that, and we also have muscle or connective tissue inflammation, somewhat separate subject. So we're going to focus today on these three types: of vata type, pitta type, kapha type, even though there's other combinations and there's other causes. So because that's what we're focusing on today, it's already three types. So let me go over those again, and we can see that in Ayurveda we're not using turmeric for pain. Now that's a Western concept. In Ayurveda we use turmeric or haldi for mostly for respiratory conditions. Dadu haldi is a type of turmeric that's even better than normal turmeric, and also we use turmeric for a respiratory problem, skin allergies, more as an antihistamine than anti-inflammatory. And many people who have tried to take turmeric for their pain realize they have to take an awful lot. It's not that it doesn't have anti-inflammatory qualities. It's just that in Ayurveda, they have better substances you don't have to take as much of. And one of those is the guggulus. Now, this is pure organic guggulu there from India. It's a black resin, and it's going to be in all of these formulas. There's many different types of guggulus, and often we combine the guggulus with shilaki, which is the extract of boswellia or frankincense. So frankincense is much more anti-inflammatory than turmeric, like at least 5 to 1. You could take straight teaspoons of turmeric and not feel anything. You'd have to probably take tablespoons of turmeric every day. But with frankincense, you could take 1/5 of that amount and feel better results. So forget turmeric for your pain. That's a Western fad. I'm sure it doesn't help. It probably takes a little anti-inflammatory, but you're better off to be taking frankincense. So let's look at the three types of guggulu formulas for these 3 types. Now, remember, you got to classify your first, assuming you don't have autoimmune condition, infection, nerve pain, or just inflammatory muscle tissue. Let's talk about arthritic pain, the 3 types, Vata, Pitta, Kapha. First type, Vata, dry, cold, cracking, usually a thin person. So this is a warming substance, and here there's different formulas for Yogaraj guggulu. See, that's the most common arthritic formula in Ayurveda. I don't know, it's probably about 17 to 20 herbs in that formula. So this is my formula, but in my formula, I put in another formula, Yogaraj guggulu. You take a teaspoon 2 or 3 times a day after meals. Nirgundi is just an analgesic herb for pain. It's very heating. And then tagar is a mild sedative, but it's also an analgesic herb and balances vata. So this is for a nervous, dry, cold person because it's going to be warming and relaxing. And these guggulus are going to get in the joints. That's what I wanted to talk about. How do Ayurvedic herbs remove the cause? Well, guggulu in particular goes in the joints and removes the toxins in your joints. That's right. That's the cause to your arthritic pain, as long as we're not in some of these other categories like autoimmune or infection. So the resins, the guggulu and the boswellia, frankincense, go into your joints and clean the toxins out that's creating the inflammation. We just have different formulas for different types of people, and that is the vata type. And then the pitta type here is cooling because this person has hot burning kind of pain. And we can see here we're using a different formula, Kaishora guggulu. There it is, Kaishora guggulu. And Kaishora guggulu is mostly made up of a lot of guducci and other herbs, but it's cooling, not heating. There's no heating herbs. Musta is known for pain. Nirgundi is also pain. Amlaki is a kind of anti-inflammatory that's part of Kaishora guggulu, but we add a little extra. So this is bringing down pitta, heat, burning sensation, hot, and also helps more with inflammatory muscle pain than Yogaraj guggulu. We use that one in most cases for fibromyalgia. And these are taken after meals. And of course, the diet has to change as well. We can't ignore changing the diet per individual as per the Prakriti and Vikriti, and also to get rid of those inflammatory foods. Now, this one is for kapha. This is for a heavy person with swelling, stiffness, more of a kapha Prakriti. Punarava, known for getting rid of swelling. Kanchnar guggulu is breaking up tissue. So there's Kanchnar in there and Punarava. So both with the guggulu. Rasna is an analgesic. Nirgundi is analgesic. Musta is analgesic. And then this one's got ginger and pepper. So this one's very hot and really the most powerful because you're dealing with a very heavy person. And now if there's inflammation where they're flaring up, where you have to lie down and you can't walk, we do use some curcumin, the extract of turmeric, because that does work. Not the turmeric so much, but the extract. And I do try to stick to Ayurveda, but there's some exceptions here, and using curcumin does help. But mostly this formula for inflammation or systemic inflammation, the main ingredient is boswellia, which is what I was talking about. Boswellia, frankincense, see? Boswellia extract or shilaki, that is the extract of frankincense. And then we do put in some turmeric and the curcumin extract. So it looks orange because of curcumin, but it's really the main ingredient is not the curcumin, it's the frankincense. And now this brings down inflammation very quickly, more for acute. So a lot of times if a person's, say, getting a lot of inflammation and joint pain, then we'll give them both of these. You take the anti-inflammatory, a couple teaspoons in the morning, a couple teaspoons in the evening. You take the pain formula after each meal. And then again, we have topical oils too. We have different ones just for, this is mahanarana talam, and this is, we call anti-inflammatory oil, and it's in sesame oil. Dashamula, another anti-inflammatory. And this you massage on the areas. This is a very ancient formula. All Indians know this, mahanarana mahanarana talam. But it's very warming, which is good for vata type of pain mostly, or kapha pain. Sometimes kapha pain, we mix it with mustard oil. But if you have a hot, burning, heat type of inflammation, you can't use mahanarana oil. We use pinda oil, which is anti-inflammatory for pitta, see? And it's for burning joint pain and more gouty arthritis and more rheumatoid and burning feet we use it for too. And this is called pindatalam. And it's also anti-inflammatory, but brings down heat and burning and redness. Now, if a person's on pain meds, these herbs do take a little while to work. They can take up to, the anti-inflammatory can start helping right away, but the guggulus do take about a week or two, and people generally have to do 2, 3, 4, 5 jars over 3 to 6 months. So it's not a quick cure. Now, if you're on a lot of pain meds and your person wants to get off of those pain meds, we will give you an analgesic tea for the time being just to help you get off the pain meds. And that, of course, is made with the famous white willow bark, which is what aspirin was made from. And then devil's claw, which is another good analgesic. St. John's wort, also analgesic, and a little skull cap and ginger. Here we can see the devil's claw right there. A nice analgesic herb. So this tea is not going to resolve your causes. It's not going to clean the toxins out of your joints and remove the cause, but it can help you to avoid taking your pain meds and your aspirin every day during the first month until the herbs start really paying off and the diet starts really paying off, because it does take time, but it's worth the effort. It's worth the time, because you're going to have a better quality of life. You're not going to have to take medication with harmful side effects for the rest of your life. So 3 or 4 months of following the diet, taking the herbs, the pain comes down, then you reduce the dosages down, and then you can fade out the herbs. Now, a lot of people still keep some of the herbs on hand and take every once in a while, particularly when they're not following the diet. Like, people will do fine until they go on vacation. Then they go on vacation, they eat the wrong foods, their inflammation comes back. They have to take the herbs and get back on their diet again to get the inflammation under control. But as you can see from those testimonials and my decades of experience, this arthritic pain is not difficult to treat. There's really no excuse for people suffering anymore. The knowledge is there, the herbs are there. We live in a very globalized world, and I can get herbs from all over the country very quickly now. And this has made it possible to be able to treat people for arthritic pain as long as they're good patients. Start cooking at home. Of course, I failed to mention, but it should be obvious, junk food, bad food, trans fats, eating out in restaurants, and overexposing yourself to chemicals, toxins, not organic food. All of these are accumulating toxins in your body. Just living near the highway, you're inhaling toxins. Eating not organic food and junk food, you're just consuming toxins every day. And these toxins accumulate, and eventually they're going to start creating havoc in your body and ultimately inflammation in your joints. So it's not something that's hereditary. I know people like to blame arthritis on it's hereditary or it's part of age. No, wrong. Because I had a lot of people in their 20s who are eating poorly, taking a lot of inflammatory substances like coffee or chocolate and sugar and nightshades, plus have a history of eating junk food, and they've got inflammation and pain in their late 20s. And then I've got older people, in their 80s and even 90s who with no pain. Of course, maybe they did when they saw me, but after they took the herbs and they understood how to avoid the pain, they have no pain. So it's not hereditary. It's not part of aging. It's either inflammation in your body or depletion in your body or excess in your body in one way or another that's creating this pain. But most of these pain, according to Ayurveda, is toxins accumulating in your joints, causing inflammation. That's the main cause. And I think I've covered that. And I hope that gives you hope that to address your joint pain If you're on your own, I recommend, first of all, you stop the nightshades, stop all eating sugar, candy, going out to restaurants, fast food, get off that coffee. There's so many people that are addicted to coffee. And if they don't have the energy without the coffee, that's an issue. When you're healthy, you have plenty of energy. I've got a lot of testimonials of people who got off of coffee and have more energy, steady energy, without the up and without the down and without the inflammation. Now, if you have to have a little something in the morning, have some green tea. The green tea is anti-inflammatory. And stay away from that chocolate. Don't listen to these people that have talked you into having chocolate because it has magnesium. You have to be very careful nowadays. There's so many fraudsters on the internet, so many fake products, so many health coaches that don't know what they're talking about and telling people to eat foods that are actually making their condition worse. So you need an individualized diet. I can't tell you the perfect diet for you. I can tell you the anti-inflammatory foods you should avoid. But if you're depleted and you're underweight and you have a degenerative bone condition, I'm going to give you dairy and meat and build you back up. If you're overweight, stiff, and swelling, I'm going to take you off of the animal protein and reduce down your amount of meals per day. If you have a lot of heat and inflammation in the body where you're getting warm and hot and flared up, I'm going to take out heating foods, even garlic and onions, even ginger, even turmeric, and bring down this heat, bring down this inflammation. If your feet are cold and dry and cracking joints and you have poor circulation, I'm going to give you more onions and garlic. So you can't say there's one diet for any health condition. We can say there's a few foods that make it worse, and we can say there's a few foods that can make it better, but ultimately the diet has to be individualized for the person. A thin person who has arthritis is very different than an overweight person who has arthritis. Not only will the diet be different, but the herbs will be completely different based on the type of arthritis, looking at the signs and symptoms. So I hope that gives you hope. I would start eliminating the sugar, the coffee, the chocolate, the nightshades right away. And then maybe you can do an appointment and I can further define the diet for you and send you the right herbal remedies to get you on the path of removing your arthritic pain, joint pain, muscle pain, or nerve pain once and for all. And maybe then you'll give me another testimonial so you can be happy and I can be happy as well. So I hope we're all clear. Arthritis is something that's very treatable. And if you need assistance, please don't hesitate to contact me. Thank you very much, ladies and gentlemen. God bless you all.